Welcome to the Health Daily Show, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Ashok Chennuru, Elevance Health Global Chief Data and Insights Officer. Ashok, welcome. Thank you for joining us.
Yeah, thank you for having me, Chitra. It's great to be here at the health conference.
Ashok, Elevance Health is the largest health insurer in the country, serving approximately 48 million lives. Share with us the mental map of your three businesses, Anthem, WellPoint, Carelon, and how the flywheel works.
Elevance Health, we focus on elevating whole health and advancing health beyond healthcare. We aim to be the trusted health partner to all our consumers. So we serve over 119 million lives through a portfolio of products that are medical, dental, pharmacy, complex care, behavioral, and digital solutions. Our health plan payer business, which is most of the listeners know, are Anthem Blue Cross Blue Shield plans, AmeriGroup, and WellPoint. Our healthcare services business, Carelon, we offer a wide range of products and solutions ranging from behavioral health to pharmacy to Carelon Insights, which is our medical benefits management and home health, and also digital products and research.
It's a recessionary environment.
Yeah.
Challenging, a lot of job loss. The stock's been depressed for the year. What are the top drivers of growth in each segment?
So in digital, which I lead, we serve all lines of business, and we are very focused on our strategic priorities for growth. And one of the strategic priority is growing our Carelon health services business. Also, being able to grow our Medicare business, through better, rating of stars and retention, and also identifying new areas through our agent business, and also Medicaid redeterminations and growing our individual business. So these are our core priorities. And how do we do that? It's with digital. So we have three categories. One is digital. So digital is the core foundation for everything we do, which is what we call our digital platforms for health. So there we offer capabilities for our consumers, that can really start with a digital solution like looking at AI symptom checker, leading to, I would say, from digital to more virtual care, and then in-person or home care as needed. And our core foundation in all this is, which I go to number two, is having good, clean data. As we serve over 119 million lives, we have data for over 210 million, by far the largest integrated data set. So what data do we have? We have data that we have from our administrative claim systems, but also we get EMR data, from the providers, and we also capture a lot of social data, behavioral data, home health, genomic data sets. So we aggregate all this data to what we call a longitudinal patient record, and we generate insights from the data. So next best action, gaps in care, etc. And they're all AI driven, right? So that's number two. Number three is, how do we harness the power of AI to truly drive meaningful advances, whether it is through automation, but do it in a very, what we call, trustworthy way, scaling AI at the power of trust. So we have also established a responsible AI institute, and some of the key ingredients or criteria for the responsible AI is being fair and inclusive. So how do we make sure we don't miss the most vulnerable population? How do we make sure that we factored in whole person health? So it's not just based on clinical, but it's based on social, and all the health related social needs, etc. So number one is fair and inclusive. Number two is robust. We need to make sure we have the right data set so there is no implicit and explicit bias. Number three, secure, because we have to make sure that the data that we are driving our AI is secure. Number four is traceable and explainable. because there's a lot of focus from a regulatory standpoint that we have to, in order to build trust, we have to be able to explain it. And then number 5 is accountable. Right?
Let's go further and talk about how that use of AI translates to economics.
Absolutely.
Because in every industry, there's a race to harness AI and to use it, whether it is to take out cost, to accelerate productivity, to help with revenue growth. So bring it to life for us, tangible examples of how you're using AI at scale and the translation to hard economics at Elevance.
Yeah, absolutely. AI has been part of our core business for the last 7 years. We were one of the large healthcare organizations to establish AI as a discipline several years back. So how does it translate into value? Number one, it starts with incorporating AI into every function across the organization, whether it is streamlining our operations through automation or leveraging AI for analytics so we can predict the next best action, or even how does AI help with consumer experience, or provider experience or our internal associate experience, incorporating AI, for those 3 categories: AI for experience, AI for like automation, and AI for analytics. So some of the early wins we got is from a consumer standpoint, we have incorporated this for Find Care, which we call a personalized match on how to get the right provider for the member based on their all their conditions. So we have improved the provider directory accuracy, which is an industry problem, from an industry average of 62% to 95%. And by end of the year, we plan to go to almost 98%. And we have also, in order to partner better with the providers, we have to improve how to automate rosters. So the faster we automate rosters, the faster we can pay them on time. And we have automated rosters which used to take average of 2 months to about 4 hours.
What's next on the horizon in terms of your use of AI?
Yeah.
There's a lot of buzz right now around generative AI, and as you and I have talked about, generative AI is not anything new.
Yeah.
So what's on the horizon? What are you experimenting? What are you already deploying next horizon of AI in your firm?
Yeah, absolutely. So because we have had an AI organization and that's been tightly integrated into all parts of the business, I would say we have learned quite a bit. I talked to you earlier about responsible AI, because moving AI at the speed of trust, right? So how has it helped us to get to the next evolution, which is generative AI, is having a good solid data foundation. Having good clean data is foundational for generative AI. Having a good responsible institute that is mature is equally critical too, right? So what is generative AI good at? It's good at summarizing medical records. So we are partnering. In fact, we are live right now in production, where we are streamlining and automating prior authorizations, where rather than taking a long time to say a yes, how do we get a fast yes on prior authorizations, which Chitra, is a industry problem. It's a provider aberration, consumer experience, and also internally for us, it's a great opportunity to automate that. However, if we are, if we have to, at least temporarily, decline or ask for more information, we always have a human in the loop. So while AI can help us automate to get a simple yes, whenever we have to tell no or ask for more information, human is always in the loop. So that way, we are doing what is the right thing. And we also monitor, is there any bias? Is there hallucinations? So that way we don't have any regulatory concerns, because this is something we are very, very, careful on.
Ashok, we're here at the health conference. There are thousands of startups that would love to do business with you.
Yeah.
Are there specific areas where you're looking to partner with startups, and what's the criteria that they have to fulfill to do business with you?
So there is, as you can see, it's a very robust startup ecosystem. And Elevance Health, for the scale we operate, we have some criteria that we would like to. So we would really look at vendors as partners that can really work with us and operate. While we don't want to boil the ocean, we want to start with something that's very clear objectives. Once we start to see quick wins, we want to scale, or we are looking for vendors who can scale with us. And those examples lead to opportunities where we have opportunities where there could be industry solutions where rather than solving it in our four walls, how can we have them solve where other payers can also benefit from it, right? Or even partnering with the providers too. For example, if we need to streamline the broader payer-provider interactions in terms of exchanging medical records, so we can eliminate faxes. Believe it or not, there is still a lot of faxes back and forth. We rather do it where multiple payers and providers can take advantage versus doing it within our four walls. So those criteria are very critical, but we are very active when it comes to vendor ecosystem partnership to take advantage of the rich data we have and also being able to scale, because there are a lot of, you asked me about AI. While we've had great success with AI in underwriting, in personalized provider match, there are a number of use cases like language translation is a great opportunity because in some cases we need Burmese speaking people, versus, AI is really good at language translation, or even helping our call center associates with assist, where it's easy for AI to come up with the right, content that can serve consumers through agent assist, or summarizing medical records from 1,000 pages to a paragraph. So our associates or providers or our care managers can look at actionable content, Chitra, versus, trying to glean through, hundreds of pages looking for that needle in the haystack.
Ashok, thank you so much for
Yeah.
joining us.
It's great to be here. Thank you for having me.